It's actually working. Finally. Good Lord, what a pain in the neck. All right, stop sniffling. Say what they're going to say here. World Health Organization. Oh, market's down another 1,600 points. What a surprise. They finally declared it a pandemic. It should have been declared a pandemic a long time ago. That's interesting. Pull this up here. Who here is surprised that this is a pandemic? If you are, you haven't been paying attention. This was a pandemic a long time ago. Nobody's watching. No. How do I see who is watching? Okay.
All right, we have breaking news now. Let's get to it. It has to do with COVID-19. And the World Health Organization has just declared
Yeah. Get this thing to monitor. Where's the Apple? Gee, Merry Christmas. All right. Where's the stupid thing? Show up on my dashboard.
All right, we have breaking news now. Let's get to it. It has to do with COVID-19. And the World Health Organization has just declared a global coronavirus. It is a pandemic at this point. Let's talk about what that means. The criteria of a pandemic describes the worldwide spread of a new disease, involves a new virus against which most people do not yet have any immunity. Virus can infect people easily and spreads person to person. We are seeing those things. It implies efforts to contain an outbreak in a region or country have failed. A pandemic describes how widespread an illness is, not how necessarily lethal it is. The WHO has said it is tightening its criteria for classifying an outbreak as a pandemic and is working on a new definition as it relates to coronavirus. All right, we have breaking news now. Let's get to it. It has to do with COVID-19. And the World Health Organization has just declared a global coronavirus. It is a pandemic at this point. Let's talk about what that means.
German Chancellor Angela Merkel is warning that up to 70% of the German population is likely to contract the coronavirus. As Germany reported its third death from the disease, Merkel said the country must do everything it could to slow the virus's spread and prevent the healthcare system from being overwhelmed. She called on people to show solidarity with the elderly and those with underlying illnesses who are most likely to die if they become infected. Merkel said efforts were also being made at the European Union level to contain the disease and stop the economic fallout.
Being aware of this fact and aware of the fact that there are vulnerable groups of the population, people with existing illnesses, older people who can have a more serious case of this virus if they catch it, means that our approach has to be defined by ensuring that our health system not be overwhelmed, but rather that we have to be able to deal with the options we have in the healthcare system to ensure that we slow down the spread of this disease. And this is why all of the measures that we're putting into place are crucial, because they gain us time.
All right, let's talk now about the outbreak here in Germany's response. We have Derek Williams from DW Science with us here in our studio, and we have our chief political editor, Michaela Küffner, also with us. Good to have you both. Michaela, let's start with you. What were the main takeaways from Chancellor Merkel's conference?
Well, first of all, that she herself mapped out really the extent of this crisis and how serious the situation is, calling on solidarity here in Germany, also stressing that there should be a European response. She reported from a conference call that there had been between the EU member states on how to respond, some 25 billion euros potentially on the table there. And most strikingly, she was pretty much word by word echoing the expert advice she's receiving with the scientists sitting there in that press conference as well, warning everyone that this crisis is only just beginning, but also calling on the responsibility of local authorities and every individual there.
And Michelle, just to make clear, she didn't announce any new measures, did she?
And the
Well,
number
officially,
of affected
what she
countries
did say is that there would be a meeting with business leaders this Friday to put new measures in place. But there was no new state of affairs, both in terms of the recommendation by the German health minister, who again echoed scientists by recommending that not more than 1,000 people should be in a room at any given event, and calling on the responsibility of regional authorities to decide whether a football match, for instance, should go ahead. That pretty much, I think, is off the table nationwide here in Germany right now.
And the number of affected countries climbed.
And also, she stressed that this was a test for society, and she hopes that it will
has been
pass.
assessing this
All
outbreak.
right, those are the measures
around the
in place,
clock,
Derek. Is this the
and
right way to
we're
tackle the
deeply
coronavirus outbreak here in Germany?
Both by
Well, I
the
think
alarming
the
levels
right way,
of spread
it's
and
probably the only way at this
severity
particular point. I
and
mean,
by
looking
the
at 60 to
alarming
70% of the population
levels
eventually
of
contracting
infection.
this infection. The only thing
We
that you
have
can
therefore
do, and
made
this
the
is repeated over and
assessment
over in the press
that
conference, is to slow it
COVID-19
down.
can be
And you slow it. The
characterized
main reason that you
as
want to
a
slow it down
pandemic.
is because you want to give the health system
Pandemic
time
is not
to
a
absorb
word to
that
use
number of
lightly
people. And
or carelessly.
that was the first message
It's a
that came
word
across. The second
that
message
if
that actually
misused
that was repeated over and
can
over again
cause
is Germany is really going to
unreasonable fear
has to try to
or
protect its most vulnerable.
unjustified
That
acceptance
includes the elderly.
that
We know
the
that the
fight
coronavirus when it infects the elderly, has a much higher mortality rate than it does with younger people, and also people who are chronically ill.
Slowing it down also gives researchers an opportunity to work on that vaccine that was also mentioned. Derek, as this outbreak spreads and people are increasingly worried, what is the most important thing to keep in mind here on this outbreak?
Well, you're going to feel it as you would.
Okay, let's look now at some other coronavirus developments around the world. There is good news from China, which has officially reported its lowest number of infections since the outbreak started there. In Wuhan, the epicenter of the outbreak, workers in key sectors are due to go back to work. But elsewhere, infection rates are still increasing. In the US, there are now more than 1,000 confirmed cases. The National Guard has been deployed to a New York
concern. So far, 93 people have tested positive among the center's employees and their families. Before that news, correspondent Frank Smith sent us this report from Seoul on how paramedics are dealing with the suspected cases.
Paramedics in South Korea are answering some tough calls in battling the coronavirus. For each prospective COVID-19 emergency, like this one, they take time to put on high-level protective gear, and only one paramedic attends to possible patients to safeguard the team. Paramedic Ko Myung-Gwon is ready for what comes, watching for the telltale symptoms of coronavirus: high fever and coughing.
To distinguish an actual case from a false alarm.
It's called
If
testing.
a person hasn't traveled overseas,
It's not rocket science. You test them.
works because
If they travel, they need to be quarantined. This is not complicated.
3 hospitals in
How in God's green earth did we put people on the moon
their emergency rooms.
with this kind
Other
of
hospitals are
stupidity?
at times unavailable because they're overcrowded.
Facts, people.
When transporting possible corona,
Oh, this is such stupidity. Over and over again, you hear from the experts, no, don't panic, don't panic. I'm not saying panic. That's not the right word. Don't take it serious is what it sounds like they're saying. I don't understand. We knew this was a pandemic 2 weeks ago. Let's hear what they said again. Stand by for news.
All right, Ron Allen tonight. Thank you. As it
Oh, shut up. All right. I need to get something to eat. Maybe somebody will show up. I want to talk to the wall.
Some moved to military bases.
This was kind of disheartening because, we got bills to pay, we got a family to take care of and feed.
Passenger Carrie Colstow has stage 4 cancer and has already missed 1 chemo session. Now in quarantine, she doesn't know how she'll get treatment next.
Hoping that the cancer isn't growing while this other potential problem.
Washington State, an unfolding crisis. The Life Care Nursing Home, the epicenter of the outbreak, 55 confirmed cases, 71 others showing symptoms, as 2 separate nursing homes report additional deaths.
The spread in the community is probably much wider than the testing suggests. Today, there's probably as many as 1,100 cases. And 6 weeks from now, that number could be in excess of 70,000.
With the number of confirmed cases and deaths nationwide climbing, more states are declaring emergencies. Many Americans taking their own precautions. A rideshare driver creating a protective bubble. In Los Angeles, one restaurant taking temperatures at the door, turning away anyone with a fever.
So many people think this is a death sentence, and it's just not.
Mark Jorgensen and his wife tested positive for the virus.
This is the nonsense they keep perpetrating. Some people think this is a death sentence.
Well, small, and if you do get it, your odds of recovery are very great.
Yeah.
But tonight,
the problem is, if 12% of the people that get it are in the damn emergency room, what do you think's going to happen? Anybody? What do you think's going to happen? 12% of 70,000 people. There isn't going to be enough room. It's going to be like a war zone. There's going to be triage. They're going to take care of the people who are the most likely to be saved, and the rest are just going to lay there and die miserably. If it all hits at once, it's going to be a huge problem. It's not that complicated to understand. We've already seen this happen in China. And it's happening in Italy. Come on. Where's the decontamination going on? I don't see streets being washed. Gonna need to have large scale. I mean, the Chinese are flying bombers over the, the area and dropping disinfectant. Supposedly it's under control. Are we going to let this get under control or what? Or what is the deal here? I don't understand. What's so complicated about this? There you go. This guy here has been excellent. All right, let's turn it on.
Now I'm going to jump in straight away today with some numbers. It's Wednesday, the 11th of March. And basically, that which I've been fearing since January is unfolding. And what we anticipated actually way back in January is unfolding. So the figures as of today, so far there's been 120,000 cases nearly, over 4,000 deaths. But I'm pleased to say that over 66,000 have made a recovery. Now, currently, there are over 42,000 people, and it's estimated that 42,620 of these, 88%, have a mild condition. And this is excellent. And indeed, a proportion of these will be asymptomatic. Maybe 20% of these will hardly know, or maybe not even know at all, that they have the infection, that they have the coronavirus disease of 2019. So good news there. But this number here is concerning. It's concerned me since I read the early data back in China, from China, again back in early February. Serious or critical. Now, these are people that are going to need some level of medical intervention. And this is like 12% of the number of people infected. So at the moment in the world, it's that. And as we go through with the numbers we've got now, we'll see that this is already causing significant difficulties. My other concern is the lack of data. I'm very concerned that in poorer developed countries where health observation and treatment facilities are less available, that there is a lot of undiagnosed cases at the moment. But of course, I don't know that because we don't have the data for that. But that's a worry, and it's a strong suspicion at the moment as well. But let's shine the light on the areas that we do know to begin with. Now, Italy has got a lot of cases and a lot of deaths and a frighteningly high death rate. We'll look at a reason for that probably in a minute. In fact, we'll do that now. High death rates in Italy, maybe because severe cases are sampled. Now, this happens at the start of an epidemic, that there's a lot of cases that aren't diagnosed, and the cases that come to the attention of the healthcare providers tend to be the more severe cases. So that can make that look higher than it actually is. I think that is the case. I believe strongly that is the case, and I certainly hope that is the case. Italy, of course, is closed down, the whole country, 60 million people basically closed down, asked to stay at home, and public gatherings banned. Now, another reason that the epidemic has sort of taken off in Italy so quickly, or apparently so quickly, is because basically Italy was caught on the hop. It was caught unawares. It was caught sleeping, whatever analogy you want to use.
They were aware.
Because, there's been spread for some time.
Chose not to do anything.
The epidemiology now shows that it's been spread for some time in Italy, and it just wasn't detected. Poor surveillance. So this is why it's so vital that we have good surveillance. High index of suspicion for people with cough, dry cough, fever, myalgia, achy muscles, undue fatigue. High index of suspicion for these things, and get these people in isolation. So it was probably spreading for some time before there was awareness in the healthcare providers and before there was awareness in the public. This is just so important. Everyone in the world needs to be aware. Lack of awareness allowed this infection to spread in Italy. We need to be aware. Global surveillance is now needed, as we've looked at yesterday. A lot of the transmission in Italy was probably within families. There was an additional 168 deaths on Monday, and this high death rate, as we've said, is probably because the more severe cases are being sampled. So, because Italy was caught on the hop, we need to learn from their experience. We need global containment now. We need to learn from the Italian experience. This is an advanced European country, advanced healthcare systems, and yet this massive degree of infection. Now, Professor Griselli is the senior doctor in charge of coordinating intensive care facilities in Lombardy in North Italy, where the epicenter of this outbreak is. And he reports 600 patients in intensive care unit with a median age of 65. Now, the median, as you probably remember from your statistics, is the one in the middle. So that means there was an equal number of patients under 65 as over 65 in intensive care. So this means there's a lot of patients younger than 65. Now, I was surprised to learn this and concerned to learn this. They're suffering from respiratory failure. Now, let's go on to some good news. In Lombardy, the area in North Italy, the professor on his interview said 3 or 4 neonates were infected and they were not severely ill. What a relief that really was. So in the entire area, just a few neonates is the first 6 weeks of life and they're not severely ill. And children don't seem to be getting sick. Good news. Children don't seem to be getting sick. But of course, children can carry it home to their parents, which is not so good news, of course. So children, now the data on this is not clear at the moment, but it's very likely that children are catching the virus and potentially spreading it to their parents. It may be that they catch it less, but it certainly seems that they're not getting sick like adults do, which is excellent news. Now, but Professor Grasselli had some messages for us. He pointed out that Italy had this first. Therefore, aren't we in the UK, for example, so lucky to have this few weeks to learn from the Italian experience? But are we learning from the Italian experience?
Nothing. Learning nothing.
I'll leave that one with you. If you are not very careful in controlling this disease, your system will be overwhelmed. So what he's saying is that the medical facilities in Italy are challenged, to put it mildly. And he's saying if there's more cases, whatever medical system you've got, you won't be able to cope. You need to reduce the number of cases that we have all at the same time. That is what we absolutely have to do. So again, what the professor is telling us, and this is something I've been going on about for some time myself.
What's up?
Is here we have a graph with the number of cases and the time. The number of cases and time. Now, left to its own devices, what will happen is the number of cases will increase very rapidly like this. And we'll end up with a peak of many cases at the same time. Then it will start to drop. But during this peak time, there's going to be an awful lot of people with the infection. And we know that when people have the infection, we can expect, as we've just learned from the Italian data, or we've just learned from the world data really, that 12% of these were serious or critical. So the bigger that number is, the 12%. Bigger that 12% is going to be.
That's a lot.
And if that number's big, we can't look after them all at the same time. So what we have to do is flatten this out. Have a vaccine. So we have to use these old-fashioned non-pharmaceutical interventions. So Professor Grasselli is saying, well, this is kind of what's happening in Italy and we're struggling. You've got the time to learn from us. Institute these containment measures that are necessary and make your curve look like that, not like that. This is what we need to do. That's what the professor's message is. Because in Italy, he says, a bomb has exploded. Now, this is a rational scientist, a clever doctor, and he's using terms like a bomb has exploded. Public has to change its behaviours. Right, so global containment now needed. Public has to change its behaviours. And we'll look at some cases of where this is happening and where this is not happening. And he actually said it's worse than a bomb because this is kind of going on all the time. A bomb is one episode. You can triage and deal with the public, deal with the cases, but this is going on every day. Huh. Now, good to hear that the number of infected health workers was reducing because of the proper use and more training on personal protective equipment. And Professor Grasselli stressed the importance of vital training and good provision of personal protective equipment to protect healthcare workers. So he says we have a great advantage. We have these few weeks that Italy did not have to prepare. And as I've said, we're going to look at cases of good preparation and not so good preparation. Now, I'm glad to see that more realistic data is coming out of Iran. The number of cases reported in Iran is now over 8,000.
Okay.
So it looks like it is to see, because we need the facts, we need the information. Information is power. It really helps us. Now, the United States is reporting just over 1,000 cases, 27 deaths.
Bull crap!
And to be fair, the centralised response in the United States has been disappointing, but I'm glad to see that individual states seem to be taking this on. So anyone who's in charge of states and medical facilities in states, individual states, please get going with this. As you already know, of course, you don't need me to tell you that. 14 states already have declared states of emergency. Now, New York area, New Rochelle. Now, New Rochelle is a suburb of New York, I think. Really, it's a smallish town, but it's alarmingly close to the centre of New York and Manhattan and all those places in New York, huge centres of population. It's close to that, and there's been 108 cases. There's been a cluster in New Rochelle, just north of New York. National Guard are involved to facilitate cleaning and other things like that. Containment measures, a containment zone has been put around New Rochelle. But as I understand it, people are still allowed to come and go from that area. So are we taking Professor Grusselli's advice, I would ask, in that area?
No.
He says behavioural change is necessary if you don't want to end up with an Italian-type situation. I do hope that the necessary measures of containment are being taken to keep New Rochelle isolated from the rest of New York. Washington State, 2 separate nursing homes affected. Now, Mayor of Seattle has said that she suspects, and we can assume the Mayor of Seattle is well informed by her community health physicians, that they believe there's 1,100 cases in Seattle at the moment. This is what the Mayor of Seattle is saying. Now, that's the number of cases in Seattle. Of course, this makes a mockery of this number for the total country. Come on, let's get on with it. Let's get this. This is the United States we're talking about, an advanced, sophisticated country. 6 weeks from now, the Mayor of Seattle fears that it could be 70,000 cases in Seattle. 12% of whom would be severe or critical, based on the Italian data, which is consistent with the Chinese epidemiological data. That is a frightening. I'm not going to work it out now, but it's a frightening number. The testing in the United States, as far as I can tell, as of yesterday, 4,000 tests, is quite lamentable. This is the situation that Italy was in a few weeks ago, that they weren't aware of the infection spreading in Italy. People were not changing their behaviour because they weren't aware. Tests were not being done because they weren't aware of the underground, hidden spread between different members of the community. I do hope this is not happening in Seattle and other places in the United States now. But I think it's safe to assume that you have to behave as if it was happening. Now, the Grand Princess, this cruise ship, dear me, that they're all being, this is in Oakland in California at the moment, and they're being unloaded. I think 2,400 passengers being disembarked to military bases for quarantine, isolation. Now, part of the problem with the States is that there's disparate information. So we're saying that number of tests, but we don't really know because it's not centralised the way it is in other countries. Now, I've learned some things from emails from American friends, and which I'm grateful for. Many states don't have sick pay. So if someone feels a bit off, they need the money, they're probably still going to go into work. And of course, if they feel a bit off because they've got a mild case of COVID-19, that means they're going to spread it to their work colleagues. And the cost is still prohibiting. And I know the tests are supposed to be free, and I believe they are, but I was talking to one person just recently, and this is a massive concern. Now, right back in January, I said my big concern about this condition is that it will start spreading and clusters will become established, resulting in community transmission in poor areas of the world where there's less developed healthcare systems with less developed surveillance. And I was thinking of what we might call poorer countries in Asia and Africa. But it seems this lack of surveillance and this lack of availability of healthcare opinion, if it's costing that kind of money to get your doctor's opinion, is meaning that similar problems could well develop in the United States. Now, Chicago is carrying on with St. Patrick's Day celebrations this coming Saturday, to which 400,000 people are due. On with St. Patrick's Day celebrations this coming Saturday, to which 400,000 people are due to attend. This just beggars credulity, really. Ireland, the Republic of Ireland, has cancelled its St. Patrick's Day celebrations, and yet Chicago is going ahead. A lot of people travelling in from other places in Illinois by train. South Korea, the number of new cases is going down, which is very encouraging, as South Korea, to some extent, is managing to change from the red line to the blue line with social isolation measures and national containment strategies that we've looked at on previous videos. China, 19 new cases in Wuhan, the epicenter, and no new cases in the rest of China, apart from a few cases that have been reported as a result of people coming back into China from abroad, so-called backflow cases. 14 emergency hospitals were opened in Wuhan. Right, now, let me ask you that question. They needed 14 emergency hospitals. Where you live, if you live in a city of about 11 million people, I think the population of Wuhan, is there the infrastructure and the capacity in your city to open 14 emergency hospitals? Can you fly in 50,000 additional medical staff as the Chinese did? If not, the case fatality rate will increase if the numbers are similar to the Wuhan situation. And we're dealing with the same virus. France, cases increasing, 33 deaths, 5 MPs and government ministers, gatherings of more than 1,000 have been cancelled. Now, there was news from a Paris hospital, one of the bigger hospitals in Paris, I won't name it, and they've got 100 COVID-19 patients and the hospital's full. So one of the bigger hospitals in Paris, basically now full at capacity because it's had 100 patients. Unfortunately, we can expect much larger numbers than 100. Football being played behind closed doors. I mean, basically, we need to suspend these things. If people are watching it at home in the telly, on TV, in a small scale area, that's fine. If people are watching it in a public area on TV, which is much more fun, of course, then the spread indoors is probably more likely than the spread outdoors. President Macron says this is only the beginning of the situation in France. Spain, quite a large increase. Germany, quite a large increase. Now, the thing about this is we know this data is accurate. And look at this superbly small death rate in Germany. Still tragic, of course. Still 2 people have died, but very small percentage. Now, I haven't got information on this in great detail, but I suspect this is because in Germany the healthcare provision is very good and they're managing this well. Now, Israel seems to be taking quite extreme precautions as well, and they've only got 75 cases, which is encouraging. All flights in and out cancelled, all people coming into the country must self-quarantine for 14 days. So it looks like Israel are somewhat preempting the red line and moving down towards the blue line, which is much more manageable. But it does show the level of public behaviour change and intervention that's required to facilitate this. Now, coming on to the situation in the United Kingdom, my country, as we'd expect, the number of cases is increasing and the deaths have increased, and that both of these numbers are going to increase, and we need to start behaving accordingly. We need more surveillance, we need more public cooperation, and we need more centralised control as well. Because we have to take responsibility as individuals for going from the red line to the blue line. That the cases, numbers are not as many in a particular period of time. This has to be for everyone. We all have to take responsibility because healthcare must be of the people, by the people. We have to do this. We can't sit back and let clever doctors and nurses and epidemiologists and scientists do it for us. We have to take responsibility. Healthcare is by the people. We have to do it ourselves. But it's for us as well. So we get the benefits of our efforts. We have to understand, and the nation has to move with us. So 500,000 people in care facilities in the UK, which we're looking at ways of protecting now. Now, one MP has become affected. Airlines are cancelling flights to Italy. A cynic might say better late than never. No, I don't want to attribute blame. But in the Italian situation, basically they dropped the ball on surveillance. They did not have surveillance in the early part of the epidemic. And because they didn't have the surveillance, they didn't realise they had to instigate the preventative measures. So I'm pleased to say that in the UK, we're currently doing 1,500 tests per day. So that's the surveillance part. And we're increasing that, hopefully this week, to 10,000 tests per day. So that's encouraging, and the results come back in 48 hours. And this test is sensitive and specific. Now, these are important points in testing. It's sensitive. That means if the virus is in the sample, the test is sensitive and will detect the presence of the COVID-19 virus. This means we shouldn't get false negative tests, or not many false negative tests, where someone tests negative if they actually have the virus, because it's sensitive. And it's specific. So it doesn't pick up the presence of other viruses. So we shouldn't get too many false positives either. So that means we shouldn't get false negatives. That means we shouldn't get false positive results. So we have a sensitive and specific test, and we're rolling out lots of them. So that's good for surveillance. This is the success of science so far in this outbreak. Now, science will be successful in a vaccine. It's just going to take time. I believe science will be successful in therapeutic treatments. It's just going to take time. Now, 12 regional labs at the moment doing the testing, and that's going to be So one football match has been, one mass gathering event has been cancelled here. So that's, I suppose we have to be grateful for that. Now, this seems to be a football manager who came back from Greece with the infection. And Greece currently allegedly has 89 cases. I'm just wondering how good the surveillance is in Greece. I don't know, I'm just wondering out loud. Now, the Czech Republic seems to be doing well. A taxi driver was identified.
That's just ridiculous. You seeing this? See what they say here. So Seattle schools close 2 weeks in light of coronavirus concerns. That's it? I think they're going to be closed longer than that. One word: asymptomatic carriers. Actually, that's 2 words. One phrase: asymptomatic carriers. Let's say there's 1 out of 1,000 that are an asymptomatic carrier and you infect 10,000 people. Well, that's going to be probably 10 or more people roaming the countryside, infecting people. Let's go back to the doctor here.
But the response is encouraging. Bandor public events over 100 people. All schools except preschools are closed starting yesterday. And the testing people at the border for the temperature and then testing have been necessary for COVID-19, and they found 1 case at the border so far. So I think what we're seeing is a mixed bag worldwide. Some people taking this seriously, other places taking it less seriously. Other places with a response which is slower than we would like to see. But we all need to move together on this. We need centralized control, and we have to take our part. Because we need to do it. So we need good respiratory hygiene. We need to have these containment measures. We need to be proactive. The Italians are now reacting. They failed to be proactive. They've given us a case study. We've had a heads up. We've had a warning to be proactive. Are we using that time, or are we squandering it? Because we now need... So remember, no shaking hands, no hugging, no kissing. Keep your hands clean, because... Sorry if you're getting bored with those. Right. Well, good morning, everyone. You are most welcome. Now, before we look at some of the dramatic developments that have happened around the world today, I just want to look at some research from China, because this sort of informs the pattern of spread that we're seeing. And this was published in Practical Preventative Medicine, written by Chinese epidemiologists and translated from the Chinese. And it relates to a study on a bus. Now, a bus passenger infected a fellow traveller sitting 4.5 metres away. So they looked at the CCTV footage of this bus. They worked out that this person couldn't have got infected any other way, but he got infected from someone who was sitting 4.5 metres behind him. This shows how this virus is transmitted in closed environments, like buses, are going to spread this infection. So that gives evidence for that. And this is about twice the distance we've normally recommended as being a safe distance. So in closed environments, proximity becomes less of an issue. We're talking about 4 metres or more here. Closed environments with air conditioning, the transmission distance of the new coronavirus will exceed the commonly recognised safe distance. Now, they also showed that another passenger who got on the bus 30 minutes later was infected by a passenger who got off 30 minutes before who was infected. And again, the Chinese epidemiologists did a lot of work on this. They were able to eliminate other causes of infections. And they concluded that the virus had been in the air in the bus for 30 minutes. And they concluded it was in the air in the bus, not from a surface, because the passengers were on different parts. They travelled in different parts of the bus. And the same study also studied how this virus, the COVID-19 virus, can survive on surfaces. And it can last on surfaces at 37 degrees centigrade, 98 Fahrenheit, for 2 to 3 days on glass, fabric, metal, plastic, or paper. So even when it's warm, it can survive for several days. So this does explain why we've seen spread in Singapore, Hong Kong, and warmer parts of China and southern parts of the United States. So at lower temperatures, the assumption would be, although that's not published in this particular research paper, is that at colder temperatures it could survive for considerably longer than that. And the other thing that people still really aren't taking full cognizance of, in my view, is that the virus can survive for 5 days in human feces or bodily fluids. This clearly puts people working in drains and sewage facilities at a level of risk. And it also shows the massive importance of meticulous toilet-related hygiene. So when we look at this new data coming out of China now on the epidemiological modalities of spread, it does somewhat inform the rapid amount of spread that we are seeing around the world. Now let's go on to what the WHO is saying about this. Now the WHO is saying the virus has a foothold in many countries, so there's a real threat of a pandemic. Well, this just doesn't really merit comment. I mean, the World Health Organization has lost all credibility here. To say there's a threat of a pandemic when there's patently a pandemic, well, they've just lost credibility here. Now, it's not saying they don't do a lot of massively good work. They do, and I'm a great supporter of the WHO. But there is a mismatch here between their public statements and the good work that they can actually do on the ground, such as supplying expertise, such as this team they sent to China to gather data on the ground, such as the personal protective equipment and test kits they've been sending around the world. So they do a lot of good work, but this, to my mind, this sort of thinking just does them no good whatsoever. But hey, they're the World Health Organization. China has had very few new cases. The containment measures, the social isolation measures in China are working very well, it has to be said. Although they are quite draconian measures that they're taking. But the key thing about China is that they are bringing the people with them. People understand. I've been getting quite a lot of emails from China and correspondence from China. And people understand. They know why this is necessary. And I'm not sure we're at this stage yet. I'm not sure the population in Western countries is moving with us the way it has in China to bring about this dramatic improvement. And it is a dramatic, sensational improvement. So when the World Health Organization says this virus can be controlled, they're absolutely right, but we need to behave like the Chinese. So from this appalling start that gave the virus a foothold, the Chinese have done amazingly well. And this reminds us of this new trusted saying that we have. Healthcare must be of the people, by the people, for the people, to paraphrase the great Abraham Lincoln. Now, what I'm saying here is that it's no good for governments just to say, do that, do this. Or for doctors to say, do that, do this. People have to understand. And when they understand, most people are reasonable and will go with you. They don't want to get the infection. They don't want their family to get the infection. They don't want their business to be suspended longer than normal. Health of country is of the people, by the people, for the people. And I don't really think we have realised that fully yet. And are not moving together collectively as the population in China now is. No new cases outside Wuhan city for 4 days. That is just incredible. And that includes Hubei province. No new cases in Hubei province or any other places in China because of the isolation. So really quite impressive. Now, the United States is quoting 754 cases. Now, again, the United States is just losing credibility by this apparent denial strategy, and the testing is still lamentable. So let's just look at some research from that. Don't take my opinion of it. This is the Cedars-Sinai Medical Center, 9th of March. Sophisticated mathematical modeling based on all sorts of things like flights to China, transmission characteristics of the virus, known cases. And by the 1st of March 2020, they're saying they estimated between 1,043 and 9,484 cases in the United States with community transmission, the amount of people infected. And of course, this is a few days ago now, so it suggests that even moderately effective population interventions to reduce transmission can have a profound impact on the scale of the epidemic. Well, we know that from the Chinese data. We know that from the case study of Singapore, which has very successfully controlled the spread of this virus. Hong Kong also of how this can be contained. So we have these models. Really, we need to learn from these, what we could only call real life experiments. But at the moment, in Western countries, we're not moving from them because we're still reacting. We haven't moved on to proactivity, and sometimes we're not even reacting. I've had quite a few emails from doctors in the United States lately who are saying that, and emergency nurses in the United States that are saying we're not even reacting to things, never mind being proactive. For a sophisticated, intelligent, advanced country. I'm not slagging off the United States. I'm going to have plenty of criticism for my country in a minute, as I did yesterday. So the finding supports the role of public health interventions in controlling the disease. That's the same Cedars study. And we know what needs to be done. Steps already suggested by public health experts, promoting social distancing, personal hygiene, restricting large-scale gatherings. All of these need to be done, but in many cases at the moment are simply not being done. Although I'm going to look at some examples of where it is being done. But the United States is behind the curve on this, I am afraid. Now, I've had quite a few emails from health workers in the tests that are available, but the state of testing, I mean, there's supposed to be hundreds of thousands of tests being rolled out this week. But as far as I know, the testing in the United States has been limited to a few thousand tests still. The testing is still way behind the curve in the United States. I'm really hoping that's going to massively change this week. Certainly the political declarations and the statements for the Centre for Disease Control indicate that they are getting their act together on that, but it doesn't seem to be filtering down to the ground yet. Now, one problem I've been told by an emergency worker in the United States is other infections are supposed to be excluded before COVID-19 testing. And the point is, that means you might need to test for influenza, other viruses, bacterial infections. And of course, this testing is all very expensive. So someone might go in, say, I need a COVID-19 test, and the doctors will say, well, you need tested for other things first, and that's going to cost a lot of money. People often have access to that kind of money. So this is a direct quote from an American emergency doctor from an email who will remain confidential. People in the US will avoid treatment and testing due to our house. It's surrounded by this complexity at the moment. And apparently, correct me, brothers and sisters and friends, money for many, many people, a heck of a lot of money. And of course, could have 2 or 3 family members. It's this is good testing out there, because at the moment, the reports I'm getting indicate that it's not out there. So the situation in Italy, all of the country is people returning should be self-isolated. So what I mean there is anyone coming back from Italy should self-isolate. So there was lots of aeroplanes, as far as I know. I don't know if those people are self-isolating. I would appeal to them to self-isolate. But we simply don't know if they're self-isolating people for the people. Italy, a great increased number in cases. The death rate in Italy is frightening of the population in Italy, because as we've looked at before from this huge epidemiological study in China of over 7,000 cases, I think it was. In fact, it might have been 70,000 cases. Anyway, I think it was 70,000 cases. All the patients that had it in China up to the 11th of February. It must have been 70,000 cases. So a huge epidemiological study in China. These are the ages and these are the percentage of deaths. Thankfully, no children recorded. The age groups, so 80s, people in their 80s, 14%, nearly 15% died. People 70, 79, 8% died. Case fatality rates. 60 to 69, 3.6% died. 50 to 59, 1.3% died. So the older demographic makeup in Italy may partly account for this, but I don't think it fully accounts for it. There's something else I don't quite pretend to understand happening here. So, yeah, am I frightened by that? Yeah, I'm not going to lie. I'm frightened by that death rate. We were due to methadone overdoses who broke into medical facilities and overdosed on methadone. Now, pneumonia. This is what is causing the deaths in Italy. So what's happening here is if these are the lungs here. So the main airway breaks down into these, the right and left main bronchial passage, the trachea that goes up to the mouth and the nose up there. So the air's going in through the nose, the air's going in through the mouth, down the airway, down these right and left main bronchus, and into the lungs. So here we have the lungs here, like that. So the left lung, so they're the lungs. Now, what's happening in pneumonia is there's areas of consolidation, as the Italian authorities have told us, bilateral interstitial pneumonia. Interstitial means in the tissues. Bilateral. And these will appear as white areas that are quite easy to see on X-rays. The lung fields themselves are dark coloured, because what is happening here is the small airway. So you might know that these break into these keep breaking down into smaller and smaller passages till we get to these microscopic bronchioles, into these alveolar air sacs here. And what's happening is these alveolar air sacs are simply filling with inflammatory fluid. So on a small scale, that's what it looks like. And that's seen as these bilateral pneumonias with infiltrates of fluid in both lungs. This means that they breathed out. Clearly, life-threatening situation reflected in this appalling number here. So that's concerned nurses and doctors in Italy who've taken the trouble to write to me in English, which I appreciate. And I'm not going to give you some of the details. It is disturbing, but let's just say that very difficult decisions about priorities have to be made and are being made in Italy as we speak. Because basically the hospitals are struggling to treat everyone that needs treated. Milan hospitals are full. Other treatments stopped in many hospitals. So basically the wards are full up with these patients with pneumonia. No spare ventilators. The situation has been described as critical by Italian doctors and Italian politicians. And this has been a concern from the start. From the start, one of my concerns, if there's a glut of people all at the same time, we are. And countries with poorer health, weaker healthcare systems are going to be hit even harder. Italy has an advanced healthcare system. France increasing cases, Spain a dramatic increase in cases. So plenty of cause for concern all over Europe. Now, South Korea, the third worst affected country after China and Italy. A lot of confirmed cases, but the death rate is remarkably low. Now, this is encouraging because I think this low death rate might be due to the phenomenal levels of testing. The Koreans are doing more testing in a day than I believe the United States has done. And this is throwing up a lot of people with milder disease or even asymptomatic disease. And because they recognize a greater number of people that are infected, that means the proportion of deaths go down. So this might be nearer the actual case fatality rate, although it's still too early to tell. And this, to be quite honest, this doesn't quite match in with the data from Italy. Now, the thing about the data from Italy and the data from South Korea is we know this is all genuine data. So we need to work out how to explain this. There's no ambiguity about the reporting in South Korea and Italy. They're both advanced countries, sophisticated countries that will. They were starting the Cheltenham Festival with 250,000 people attending. And I'm not going to comment on that. It's just, anyway, that's what's happening. In 2 weeks' time, apparently, respiratory symptoms will need self-isolation, cough, a fever, achy muscles, undue fatigue, shortness of breath. Respiratory symptoms will need self-isolation. The Romanians have stopped the flights. My country hasn't. The Romanians are insisting on 14 days quarantine. We are merely suggesting it. In my country, we're having the Cheltenham Festival with 250,000. Necessary. So my country is doing none of these measures. So I'm delighted to see that Romania is being proactive in these measures. Now, as I've said, these aren't confirmed. These are just based on a few emails I've had from Romania, but they are reliable people. So I strongly suspect that is the official situation in Romania. So my congratulations to the Romanian authorities on that. Ireland, 24 cases. Delighted to see that now St. Patrick's Day is like a huge thing in Ireland. It's just, St. Patrick, the great patron saint of Ireland, and admired in Ireland and around the world. And to cancel St. Patrick's Day in Ireland is a huge thing. And I'm delighted to see they've done it, because on St. Patrick's Day there's public gatherings, there's meetings in pubs, there's drinking alcohol, there's consequent physical contact that might not otherwise have been. So the right move. Iran, who knows what's going on in Iran? I've got a few ideas of what's going on in Iran. Basically, it's not good. The situation in Iran is not reflected at all. I did learn one tragedy. 30 people in Iran have died of alcohol poisoning, because there was fake news or misinformation that alcohol protected people against COVID-19 virus. And of course, some people don't need much encouragement to drink. I don't know what the drinking situation is like in Iran. I assume in Islamic culture, a lot of people aren't used to alcohol. So if they drank a lot, it's not surprising that people died of alcohol poisoning. Plus, there might have been some dodgy alcohol around as well. I don't have the details, but let me just be clear, alcohol does not protect against COVID-19. It's good on your hands for washing your hands. If it's greater than put on this, our hand gels. But the alcohol has to be at least 60% and preferably 70% or more to kill the alcohol on the surface of the hands. But whatever you do, don't drink it. That will not help. Right, so we've looked at a few reliable sayings already today. And that's another one. Pleased to see Prince Harry doing elbow bumps yesterday at his last official royal engagement. So elbow bumps are good. This seems to be the new cultural norm. We don't shake hands with.
This is ridiculous. Is it ethical? What if you don't have a choice? What if you're incapacitated or sick and you can't leave? Is it ethical to leave to get food? It's a stupid question.
Well,
Maybe we'd be just better off if we gave it to everybody, and then in a month it would be over.
Oh my God. There is so much misinformation going on with this novel coronavirus. It boggles my mind. And it's causing people to panic, make bad decisions. My patients are confused. So I decided to make this video and take on misinformation by watching some clips, reading some articles with you, and really understanding where the misinformation comes from.
We have contained this, I won't say airtight, but pretty close to airtight. We've done a good job in the United States.
No, we did not contain it. No, it's not even remotely close to airtight. Yes, we've made some steps in the right direction of trying to quarantine people, and we should applaud our public health professionals. But to say on national television that this is contained? No, especially February 25th. My God, the numbers are still going to go up tremendously in the US as more testing kits become available. So no, not airtight, but also still no reason to panic.
Are you taking this vote too seriously wearing a mask right now?
Look, members of Congress are human petri dishes. We fly through the dirtiest airports. We touch everyone we meet. So if anyone's going to get coronavirus, it's probably going to be Congress.
I'm at a loss for words here. He's wearing a gas mask. This isn't even what we wear in the medical setting when we're dealing with someone who has the coronavirus. This has to be for some kind of shock value, and clearly I'm watching it on TMZ, so he got the nation's attention. Well,
that was actually interesting. Why did I do that? Oh, where were we?
Maybe we'd be just better off if we gave it to everybody, and then in a month it would be over.
Oh my God. There is so much 30-year-old, if I get the...
Do I exactly the same?
Oh. That's a storm. Not a object. Stop with the as the coronavirus. This has to be...
Going to get coronavirus, it's probably going to be Congress.
First of all,
I'm at a loss for words here. He's wearing a gas mask. This isn't even what we wear in the medical setting when we're dealing with someone who has the coronavirus. This has to be for some kind of shock value, and clearly I'm watching it on TMZ, so he got the nation's attention. You're a lawmaker. You're the person we look to give us accurate information to protect us. Take off the gas mask. Act like a human. Get educated on the subject. Stop with the misinformation.
Think about how the world would be if you tried to quarantine everybody because of the generic type flu. Now, I'm not saying this is the generic type flu, but maybe we'd be just better off if we gave it to everybody, and then in a month it would be over, because the mortality rate of this probably isn't going to be any different if we did it that way.
This is what happens when you have experts in. This is horribly wrong. No, we shouldn't just gather everyone up and give them the novel coronavirus. That is a horrible idea and a horrible sentiment. Now, spread of the flu, Because we have things to prevent the flu, to treat the flu. We have medicines that if you get the flu, we can reduce, go get the flu, you'll have a milder case. For the novel coronavirus, we have no such thing. So we absolutely need to slow this thing down by quarantining individuals so that we can get these medications made, approved, safety tested, do the same thing with the vaccine so that unnecessarily we don't cost people their lives. The whole purpose of herd immunity so that we can get these for the novel coronavirus, so that we can get these for the novel coronavirus, the flu, because, but it's not up and give them the knowledge, what his position is.
If this probably isn't going to, we'd be just, think about how the world,
like a human, get a lawmaker. You're dealing with someone who has a lot of loss for words here. He's
members of Congress.
So the thing here to remember is the fact that this is prevention. It will actually do something. He obviously it's not the message that this physician wants to send, but he's making it more complicated. Like he makes it seem like that this isn't effective. And if it's covering your eyes, your mouth, and your nose, and has the appropriate filtration, then it is effective. The reason why most people don't wear them is because most people don't have $200 or $300 for a proper gas mask. And early gases. Well, gases are actually more fine than most of the things that these particulate filters will stop. All right, let's continue on with this guy.
maybe we'd be just better off if we gave it to everybody, and then in a month it would be over.
Oh my God. There is so much misinformation going on with this novel coronavirus. It boggles my mind. And it's causing people to panic, make bad decisions. My patients are confused. So I decided to make this video and take on misinformation by watching some clips, reading some articles with you, and really understanding where the misinformation comes from.
We have contained this, I won't say airtight, but pretty close to airtight. We've done a good job in the United States.
No, we did not contain it. No, it's not even remotely close to airtight. Yes, we've made some steps in the right direction of trying to quarantine people, and well, here's what corona here in the United States, the numbers are going to skyrocket in the next few days. But that's simply because we're testing people, not because there's this new giant outbreak. There's also something to be said about the media's obsession with chasing numbers.
100,000 confirmed cases, 3,300 deaths, 230 known cases, 21 U.S. states, 12 people have died.
Yes, numbers are going to go up. This is a virus that spreads. No matter how much we try and quarantine, there's still going to be spread of this virus. The idea is that we try and control it to the best of our abilities, but know that there will be fluctuations in the daily numbers. That's why I recommend not looking every single day and not being scared by headlines that we see on Twitter that are like, oh my God, Governor Wolf says there are now 2 confirmed cases in Pennsylvania. There's going to be a lot of confirmed cases in Pennsylvania and the US, especially as we get more testing kits available to the doctors and nurses on the front lines. But that's okay. We should know how many cases are out there. We want to know so we can properly calculate. They'll have more information to study these people, to maybe put them in clinical trials. But the more the media shows breaking news, alert, outbreak warning, the more we're going to panic. And the more we're going to make bad decisions with bad information. And I urge the media, please be responsible in your reporting. Get a doctor on board. Get a research. They want to get tested for a condition they shouldn't be tested for. So let's ease the misinformation out of our headlines. Let's talk about the facts and let trusted sources like the CDC and WHO guide us properly as we move forward throughout this pandemic. I put together a playlist of all my coronavirus videos right here, and I put together a playlist of my Reddit thread videos where doctors discuss some of their most difficult cases, embarrassing cases, and I think they're both worth a watch. Which one are you clicking on to stay happy and healthy?